Thank you everyone for coming. We're just going to let everyone stream in now and we'll get started in just a few minutes. Feel free to invite other staff to attend. You can share your link and this will be recorded and we will share it with you afterwards. So we'll just give it a few more minutes. David, we're ready when you are.
Terrific. Thank you, Nicole. Good afternoon, everybody. Thank you so much for taking time out of your busy day to join the Alameda County Public Health Department and the Long-Term Care Facility Task Force in this focus call for Alameda County's RCFEs. My name is David Farrell, and I'm a consultant for the Long-Term Care Facilities Task Force. And thrilled that you could take some time out of your day today. Thank you on behalf of the county. We want to thank you for the heroic efforts that you are making to keep your residents and staff safe during these very trying times. Let's go ahead and get started so we have plenty of time for questions and answers, and we have some really important news to share with you this afternoon. So please keep in mind that we have a long-term care facility outbreak task force here at the county, and that includes our outbreak team that works on prevention as well as providing strategic anticipatory guidance to our long-term care facilities. We, of course, also support facilities in response to outbreaks and help them to prevent and mitigate spread. In addition, we have a partnership with the Alameda County Hospital system, and we work collaboratively with them for the benefit of the long-term care facilities within Alameda County. If you should experience an outbreak, we will assign an experienced long-term care facility outbreak nurse to you and your team, and that nurse will work closely with you to prevent and mitigate your outbreak. They'll work with you and walk you through all of the regulatory requirements as well as our recommendations and guidance. We'll help you to implement infection control measures, cohorting practices, and make sure that you have an adequate testing plan with good, timely turnaround times. And we want to make sure that you have access to all the resources that you need to keep people safe, including on-site visits from the state, referrals to testing resources that we have access to, as well as PPE and staffing resources should you need those types of resources as well. In Alameda County, there are over 250 large and small RCFEs, serving 10,000 residents and employing some 6,500 healthcare personnel. A large number of that 250 are very small RCFEs that are 6 beds or less. Here's some information for you just specific to the RCFEs in our county. Of the 250 in our county, 54 have experienced outbreaks, and 20% of all RCFEs have experienced an outbreak. 14 have had 1 or more outbreaks, and 10 have resulted in at least 1 death. 30 of those outbreaks, 30 of the 54 involved only staff. And if you recall, since June 26, the CDSS indicated that RCFEs should be testing 10% of their staff each week. There's been 439 total positive cases in our RCFEs in Alameda County. That represents 20% of all the positive cases in our long-term care facilities. And those 166 6 beds or less RCFEs have experienced just 8 outbreaks so far during the pandemic. Throughout the world, COVID has had a very serious impact on assisted living providers, or as we call them in California, residential care facilities for the elderly. Here in the United States, 30% of all long-term care related deaths have occurred in assisted living or other care homes. Throughout the world, the International Long-Term Care Policy Network study mortality associated with COVID-19 in care homes contains evidence from 21 countries and finds that 46% of all COVID-related deaths were residents of non-acute residential and nursing facilities. More research. More than half or 40% of all residents with COVID are asymptomatic. A recent study was just released that shows that found that facility-wide testing was much more successful in detecting lurking infections than only testing those with symptoms. The 173 facilities that conducted the baseline testing of all residents and staff identified more cumulative rates of asymptomatic and pre-symptomatic infections than did facilities that tested only symptomatic and exposed residents and staff. Asymptomatic people have been found to be just as infectious as people who show no symptoms. And therefore, the current study's results underscore the importance of universal facility-wide testing to identify and isolate cases. For the most part in our RCFEs, we've only been identifying and testing symptomatic individuals. And this research study advises us to do more than that. In addition, we have numerous studies that point to the fact that staff are the unknowing vectors for bringing the virus in. These 4 prominent research studies all point to the fact that staff, unfortunately, are the ones that bring the virus in. From Harvard University, their recent study showed that the infection rate in their long-term care facilities that they studied had a strong correlation to where their staff members lived. And if those neighborhood characteristics had high density, high use of public transportation, a high number of individuals who were non-white, these were closely associated with large outbreaks. UCLA tracked people's cell phones and found that those facilities that had the largest outbreaks had the largest number of staff who worked in other facilities. And in some cases, they were connected to 15 other long-term care facilities in a geographic region by their staff. The very first outbreak in Kirkland, Washington that occurred in a skilled nursing facility, the research shows that indeed the virus was brought in by the staff. And in New York City, where they have a similar somewhat draconian admission policy where all nursing homes are required to take new admissions irregardless of their COVID status or testing, they wanted to determine whether that admission policy led to their large outbreaks. But lo and behold, they found just the opposite. Once again, it was the thousands of staff in the New York nursing homes who were infected in mid-March and transmitted the virus unknowingly. In addition, this research study points to the need for preemptive testing of residents and staff. It found that long-term care facilities in which testing was conducted after a confirmed case were found to have significantly higher proportions of infected residents and staff members after initial response testing and 4 weeks after follow-up. In other words, testing after finding a symptomatic individual led to a much larger number of cases. Whereas long-term care facilities in which testing was used as a preventative measure, initial prevalence was significantly lower and fewer cases were identified during follow-up testing. So as a result of all of this mounting evidence, we saw that the Department of Social Services released a PIN on the 6th of October. And There's aspects of this provider information notice that were positive and certainly influenced by the research. However, it didn't really go far enough. As many of you know, the PIN suggested that you test 25% of your staff each week instead of 10%. There still is no requirement of our RCFEs for baseline testing. During an outbreak, it suggested that you test every 2 weeks instead of every 14 days. But it doesn't require that 14 days pass since a positive case. In addition, the PIN indicates that residents returning from the hospital and have not been tested may not need to quarantine for 14 days, but it's not required. In addition, it indicates that residents in quarantine should be monitored for signs and symptoms, but not how often. And under visitation, it does not indicate that the RCFE should close to indoor visitation if they are in the midst of an outbreak. So, in response to the mounting research and this PIN that came out that didn't really go far enough to keep residents and staff and our RCFEs safe, the Alameda County Public Health Department is putting forth a strategy to keep vulnerable populations safe, and this will directly impact the RCFEs within our county. So health orders are being drafted up now that will make it much easier to conduct testing in long-term care facilities in Alameda County. We'll be issuing a health order that will provide a standing order for testing of all residents and staff in long-term care facilities, including RCFEs, so that you won't be burdened with having to get a doctor's order to conduct testing. In addition, we are drafting a health order that will require all long-term care facility staff, all healthcare personnel, to receive the flu vaccine in a reasonable amount of time. Unlike other years, there won't be the option of just choosing to wear the mask instead of getting the vaccine for healthcare personnel. And number 3, in this strategy, we're drafting up a health order that will require all RCFEs to conduct baseline testing of their residents and staff before the middle of December, and that requires regular screening testing of their staff each month, and that enhances the outbreak requirements of RCFEs. And here's some details on what you'll find in those health orders when they're released. But here's the goals of implementing those health orders in Alameda County. Number 1, we want to do this because we want to conduct preemptive preventative baseline testing in all the Alameda County RCFEs to identify positive asymptomatic residents and staff, isolate them, quarantine others, and mitigate spread. We want to better prepare our RCFEs to deliver timely response-driven testing when they have an outbreak by equipping them with the experience of baseline testing so that they can be self-sufficient should an outbreak occur. And number 3, we want to conduct preemptive preventative screening testing of 100% of RCFE staff to identify positive asymptomatic staff, isolate them, quarantine others, and mitigate spread. Those are the basic goals of this strategy, and it's all based on the mounting research. So here's what you might find in terms of the specifics within the health orders that we're planning to issue. All RCFEs will be required to complete baseline testing of all their residents and staff by December 15th, 2020. After baseline testing is complete, RCFEs that are 6 beds or less would be required to conduct screening testing of 25% of their staff each week. And after baseline testing is complete, RCFEs 7 beds or more would be required to conduct screening testing of 50% of their staff each week. In terms of the additional outbreak management requirements for RCFEs that you'll find in the health orders that we'll release next week, An outbreak is not officially cleared until sequential rounds of response-driven testing result in no positive cases and 14 days have passed since the last positive case. So we're adding the and 14 days have passed since the last positive case. Now, there's certain Alameda County RCFEs that have already done baseline testing or response-driven testing, and they would not need to complete it again. So there's, again, about 56 of these RCFEs that are already out there. They've experienced an outbreak, and therefore they've conducted response-driven testing, and they have experience with that. Or they decided on their own to complete baseline testing of all of the residents and staff. And as a result of those experiences, we would expect that these RCFEs have a lab contract in place, and therefore they can test timely should they identify a positive case when they're screening their staff. We have plenty of support for our RCFEs to meet these additional testing requirements. We can deploy testing teams to assist small RCFEs with meeting the new baseline testing requirement. And in fact, since September 1st, we've been calling 6-bed or small RCFEs and offering free baseline testing. And many of them have taken us up on our offer. In addition, RCFE staff can be tested at our Alameda County Public Health Department community testing sites. Alameda County will also be distributing to all the RCFEs hundreds of pulse oximeters so that you can closely monitor the vital signs of your residents. And we've also organized a flu vaccination strike team that will be deployed to smaller RCFEs so we can help you vaccinate your residents and staff. And in addition, we have a solid pool of lab providers that we have vetted. And we will provide you with that list so that you can tap into our lab processing vendor pool and have contracts in place as we face the winter months. What we're doing is not unlike what other counties have already done. Here's an example of Contra Costa's health order for testing, and there are 400 RCFEs that are in Contra Costa County. As you can see, they required baseline testing of all the residents and 400 RCFEs to be done no later than July 31st, 2020. And they had all the requirement that all the staff in the RCFEs in Contra Costa County be tested no later than July 6th. So other counties have set this precedent, and we would like to make sure that we take a more aggressive stance, if you will, in terms of the requirements of our RCFEs when it comes to testing and outbreak management. As most of you know, CDSS repeatedly says that if there are different requirements between the most current CDC, CDPH, CDSS, DDS, and Alameda County Public Health Department guidance, or Alameda County Public Health orders, that the RCFEs in Alameda County should follow the strictest requirements. And just to make clear that the health orders that will be coming out related to testing in RCFEs will be stricter requirements than what has been imposed by CDSS in the PIN that we were referring to earlier. So a couple of other things. We hope that you have already registered for the vaccine, and we've been sending out notices. And we also just learned that they have extended the deadline to register to participate in the National COVID Vaccine Distribution Program. We strongly encourage all the RCFEs in our county to sign up. It's easy to sign up. And even though they've extended the deadline, we certainly hope that you will sign up this week. In addition, just a couple of words on visitation. Just to be clear, Alameda County is very much in line with CDSS and CDPH in terms of their interpretation of safe visitation. So just to reiterate what is on our website that you see here, and just to review real quickly PIN 2038 in their outline of visitation, of which Alameda County is aligned with. So they always encouraged, of course, virtual visitation to take place. And I know that many of you have made investments in virtual visitation. I know that most have also made investments to make outdoor visitation very comfortable for your residents and visitors. And then, of course, indoor visitation is a little trickier. So with this guidance, it basically clearly says that if you have no transmissions of COVID-19 in the last 14 days, if you're not experiencing staff shortages, if you have adequate supplies of PPE and essential cleaning supplies, that you really want to accommodate safe indoor visitation. And of course, that requires facilities to follow these core principles of COVID-19 infection prevention. And I certainly expect that you're well in tune with all of these by now. And then of course, screening, just a little couple of words about screening, because we're getting tired, and I know that you're getting tired too. And for many of us, we're in this kind of disillusionment phase, but we certainly don't want to put our guard down. And staff screening and screening of visitors is incredibly important right now, and certainly not a process that we want to lax at this time. So around the country, we've learned about screening best practices, and we've learned that the facilities that do it best have these core principles at the heart of it. It's seen by all as a critical process that can be completed 24 hours a day. It's checked frequently by the leadership team to make sure it's been doing right and the process is working correctly. The staff who are assigned to the role of screenings, other staff are trained, they're competent, they understand the importance of screening. They don't take it lightly, I should say. Screening of staff occurs throughout their shift, not just at the beginning of the shift. Screening questions go beyond the minimum questions. So some facilities are even doing smell tests as part of their screening requirements. And finally, the screening process is measured and it's audited frequently. These are the critical aspects of screening best practices. Coming back to visitation, I won't get into all the details here, but please read PIN 2038 to get all the details related how you would go about safe visitation. It's incredibly important that this is done well, and we keep in mind how important this is for our residents' families. So we want to be able to do this safely, and we want to be able to keep doing it throughout the winter months so that our residents feel connected to their loved ones. So with that, I think I'll turn it over to Nicole Howell, our Ombudsman. Nicole?
Hello, everyone. Thank you so much for your time today. I just wanted to spend a couple minutes, we talked last month, but I just wanted to remind everyone that Ombudsmen are resuming normal duties, so you will see them again in your buildings. Our staff are diligent, as David has requested, in our daily health attestations here at the office, which include temperature screenings, symptoms checking, as well as sort of where they have been in the area. Our staff are also adhering to that higher rate of testing of 1 COVID test per week. And I want to assure you, in addition to sort of if there were symptoms, but of course, if there were a positive test, we would stop that person from doing visits. So we are working right alongside of you to prevent the disease and ensure that our staff are not vectors. But I want to remind you that Ombudsman will have unfettered access to facilities. So when they come in, you're more than welcome to do your screening, and I encourage you to do that. It's one thing we look for. We want to know that the facility is screening visitors, and so we want to know that you're screening us. We will of course meet with residents, without staff there, and we'll check in with staff as necessary. We are happy to let you know that we do complete daily health attestations, and our last COVID test is of course negative, but we won't be sharing that or showing you our test. That's under guidance from the Office of the Long-Term Care Ombudsman. and also is conforming with what California Department of Public Health and California Department of Social Services are doing for their surveyors. So I want to thank you for all of your hard work over the last many months. I know that you are very tired and your staff have been doing just double time work trying to keep the disease out. And we are at a new precipice where we're saying, hey, it's time to let visitors back in, and that we're trying to find that new balance. But I just want to say I support the public health efforts and the testing for RCFEs. I think it mirrors what many of our neighboring counties are doing, and I think it's an important step in helping us combat the disease. Now, David, is it okay if I go ahead and talk about the pulse oximeters?
Oh, sure, please do.
Excellent. So Alameda Public Health is giving you all a gift. So as many of you know, the pulse oximeters are a powerful tool in combating the disease, particularly in RCFEs where we're not medical staff, right? We're not like skilled nursing facilities. And it's a powerful tool to help a facility know if an individual is not feeling well, particularly those who experience dementia, who are not able to tell you if they're in any kind of respiratory distress or if their pulse is decreasing. So we are going to be, over the course of November, delivering to all of the RCFEs in Alameda County their own pulse oximeter with an instruction sheet in English, Spanish, and Tagalog as to how to use that. This little portable $20 device. And we think it will help us to keep residents safe. We think it will help us to screen and identify issues early. And I think this is a really important step on behalf of the Public Health Department and how they are working with other counties to adopt best practices. So over the course of November, you will begin to see these kind of devices. We'll let you know when you can expect delivery, but start to plan around mid-November. So I want to encourage everyone, if you have questions, you can drop them in. The Q&A is the preferred location, but if you've dropped it in chat, we're going to get to those. And so I'm going to go ahead and start reading them off to you, David, and you can feel free to go ahead and answer. And so the first one comes from Lisa, and she says, with a health order for flu, if the staff decide not to get the flu shot, would they not be able to work in a long-term care facility?
We don't have all the details of that health order as it is being drawn up, but my understanding is that they absolutely wouldn't have the option of just saying, no, I would not like to have the flu shot. I'd prefer to wear the mask, considering they're already wearing a mask. So many counties are strengthening their health orders around flu vaccination for healthcare personnel. And for those who opt out, they're going to have to jump through some additional hoops in order to opt out. And should they not be able to accomplish that, then yes, they would have to be removed from the schedule if they didn't have a valid reason for not getting the flu vaccine.
Yeah. And we hear from Vivian, and she says that they tested 100% of their residents and staff at the end of July. And she wants to know, should they do another round of baseline testing by the December deadline? And she also shares that they have been testing their staff, 25% of their staff weekly. So I want to say thank you to Vivian for doing that.
Yes, I think a lot of providers are taking, this very seriously and doing more than what is regulatorily required. If you did do baseline testing and you have a contract in place and you did that in July, then you get a pass. You're already well equipped. Again, one of the strategies here is to make sure that those facilities that haven't been doing any testing have experience with testing, that we get baseline testing done, and that they're better equipped to be self-sufficient should they have an outbreak, and to be self-sufficient to do the screening testing of the staff. So the answer is no, you would not have to do it again.
Mm-hmm. So we have a really important question from a small 6-bed administrator, and I think that this is an important one to wrestle through. So Mary says, if you have a small facility, do you have to let people in if it's almost impossible to keep facilities out of the common area?
The question is in regards to indoor visitation?
Yes, exactly. Basically, she has a small facility and she's saying, I think what she's saying is like, hey, how do I do this in a small home-like setting when it's hard to keep family members out of the common area?
Yeah, that would be a struggle. You know, I would really hope for a covered porch in your case. But I think in that case, talking to your CCL um, uh, representative for guidance might be the best approach, who knows your physical layout better than I.
And David, if I could add, I think, you know, we here at Ombudsman get a lot of questions from families, and ultimately we serve residents, but sometimes some of the ways we serve residents is by serving facilities. And so families are really excited to get back into facilities, and but they have to follow rules, right? So if they are unwilling to stay in the resident's room, then they simply cannot visit. And so I think it's really okay for you to say like, hey, this is the code of conduct we're expecting of our visitors right now. And if you're not able to adhere to that, we're not able to let you in facilities. And if we as ombudsmen know you are making a good faith effort to facilitate visits and you're trying to have them inside, and a family member calls us and they're just complaining, we try to help work it out, you know, we can also say like, these are the guidance provided through the PIN, provided through the public health order. It's required that you adhere to this in order to be able to visit facilities. And so I also would say, like, reach out to our office. We're happy to help you figure out how to have that conversation. I think outside works for now, but it's already turned cold in my neighborhood. Just 4 days ago, suddenly I was like, gosh, it's fall. And so I want you guys to think ahead about where are other creative areas. So for example, is there a heated garage you can use? Is there an area off the kitchen that's available? Where are different ways that people can have visits, realizing that they of course need to schedule them with you, and you need to schedule time to disinfect between visits.
Yes, good points. And visitors have to be able to follow these core principles, or you reserve the right to ask them to leave.
And remember, of course, it's the residents. Like, does the resident want to see that visitor, right? The resident might not want to see everyone in their family. They may have specific people they're looking to visit with. On that same end, Lisa asked, can we use outdoor heaters? To which my response would be, I am not a fire chief, so I can't, or building code inspector, so I can't speak to that. And I would encourage the facilities to reach out to their local city fire code inspector to see how they can use those kinds of things safely. What do you think about that, David?
Yeah, that's right.
David, you mentioned a PIN earlier, which went over the guidelines for facilitation, for visitation, and you had a great slide. I'm wondering if we can put that up again, because Candace asks, what exactly are the rules for indoor visiting?
Oh, yes, they're well spelled out in the PIN 2038, and yeah, they're very, you know, here they are, but clearly, you know, you're very responsible to gather information in order to do contact tracing should an outbreak occur. So as you can see, that third bullet from the bottom, you really have to be able to capture all of the information of this visitor, as well as really emphasize to them that should they develop symptoms within 14 days of leaving the facility, that they absolutely must get back to you and inform you of their symptoms and if they're positive.
And so Jocelyn has an important question, and she's saying, you know, one, where can they access the list of testing sites for COVID testing? And also, how can they work with you if they have residents who can't go out to get on-site testing?
Yes, we have resources that we can deploy to small facilities to do on-site testing of residents and staff to help you with your baseline testing. In terms of the staff going to the Alameda County testing sites, Ron, would you be able to share where that information is located or how we might distribute it?
testing.
Community
So
testing sites, yeah.
So yes, at our Alameda County Public Health COVID-19 page, there is a testing site link that you can go to, and it'll delineate all the current and active testing sites that are located throughout the county.
Thanks, Ron.
Guys, if we have any more questions, we'll stay on for a few more minutes, and I want to encourage you to take advantage of this time because we have David and Ron and Terry, and they are really the folks who are leading the effort in Alameda County. This is a great group to ask questions of in a no judgment space. So if you have a question, think for a few minutes and drop it in the Q&A or the chat. I want to reiterate that we're going to be sending out both the recording and the slides following this presentation. And I will also include the link of where you can sign up to get the COVID-19 vaccinations and any other resources we can find. But I also want to encourage you, we've been holding these once a month, so please look out for these invitations. And I think we have another question. It is, again, Jocelyn says, what about the residents who can't get out there? Any available people who can come to the facility? So really asking, are there any mobile testing options for the residents that just it really is very hard to move them?
Yes, we have those testing resources available, and if you reach out to us with that need, we can deploy them to assist you with your baseline testing.
Mm-hmm.
Will come on site. They'll come on site into your facility and do the testing.
And David, do you know about how long it takes to set that up?
Well, you know, it really is a matter of, there is a little bit of paperwork involved for the RCFE to complete, and usually if they can get that done timely, we can deploy a team to do testing within 5 to 5 days or so. So you really want to be in contact with us and get that scheduled so we can help you. And we've been reaching out ourselves to the small facilities in the zip codes with the highest positivity rates and offering that baseline testing. If any of you in the call have received those calls from us and for some reason didn't take us up on our offer, please reconsider and get back in touch with us, and we'd be happy to do it for you.
Absolutely.
I see that Mary wrote a question saying that caregivers can't use the pulse oximeter, and that's not how I read it, Mary, but I'll reread it and be in touch with the Department of Social Services to just clarify. Thank you for alerting us to that.
And Joshua asked how they can reach you. And so David, can you show the slide with the contact information?
Yeah.
And while we're doing that, we have a really interesting question of, for the mobile testing, is this covered by insurance of residents, or is it covered by the county? Is the facility responsible for covering that fee? And will you be, in terms of the standing order, they're asking you about a standing order. I think what you're saying is the health order would provide that for them.
Right, the health order would give you a physician's order to do testing of your residents and staff, and you wouldn't be burdened with having to call the primary physician for your residents. It would just take care of that. So we're trying to remove as many barriers as we can to make testing really easy. When we have a provider call us with the need to come in to do testing for them, again, our goal is to do that for you. We would not bill you for it. But when we leave, we want to be reassured that you'll be self-sufficient going forward, that now you have experience with it, and we're going to give you information on how to set up your own lab contracts so that should you have an outbreak, you'll be ready to go with timely response-driven testing. And this is really the goals, as I mentioned, are two-part. Number one, it's to do baseline testing to find asymptomatic individuals before it's too late. And number two, to create self-sufficiency amongst all of our RCFEs as we go into the winter months. And here's our contact information. And we're happy to help you in any way that we can.
So guys, if you have any other questions, please feel free to drop them. As someone does ask, they said, should we send the testing information or just keep it for our records? So I think the question is, once they have tested, what do they do with the information? So maybe walk us through a scenario of if they're all negative versus if you do have a positive test.
Right. Well, all labs have a reporting responsibility to report all test results. So, you know, if we go in and do the testing, or an outside lab vendor does it, then they have reporting requirements to the county and to the state and to national databases. So they're usually reporting all results, negative and positive, and that's how we determine positivity rates. If you were to be utilizing your Abbott Binax Now antigen test kits and be one of the few RCFEs that have a CLIA waiver to do so, then suddenly you would become the lab responsible for reporting all of those results. So with the exception of the RCFEs who are using the antigen tests, the responsibility of lab result reporting wouldn't fall on you. However, you would have a responsibility to make sure that the primary care physician and the resident and their family knew of the results. That would certainly be the responsibility of yours. But the lab would take care of the reporting responsibility to the regulatory bodies.
Mm-hmm. Yeah. And we had someone ask another question, and I just think, David, let's say this very clearly, and it was essentially so that they must have 100% of staff and residents tested by December, question mark?
Yes.
So
baseline testing.
Again, just say that section again so everyone can really hear that.
That's right, yes. That would be a new health order that we're drafting that would require that all the RCFEs who haven't done baseline testing yet would be completing their baseline testing of residents and staff by December 15th, 2020.
And then ongoing testing after that was what you were saying also.
Yep, then screening testing after that would be the requirement of the staff.
And again, I want to say my staff get tested also. So we have plentiful testing sites in Alameda County that folks, they're throughout the county. They're very easy to get to. So we're very lucky in our community to have that.
Yes. Great. Any other questions?
David, I think you answered all their, we've answered all of them. So I just want to remind everyone, we strive to have these once a month, and we share the information with you via email to let you know about these. So please make sure we have your updated email contact information. And we will share, of course, the recording and the slides with all participants.
Yeah, and when we meet again, we'll likely focus our webinar on preparations for the flu and COVID.
Excellent. Well, David, thank you so much for your presentation. Thank you everyone for making the time for this call. We know how busy you are. We know how hard your staff are working, and we appreciate all of your work.
Yes, thanks so much, everybody. Take care. Bye-bye.